Hey, Daniel Knox here. As somebody who's been in the fertility industry for years, this is what I would personally do to be able to overcome infertility as a couple. And obviously, this is what I recommend to friends and family as well. All right. So let me share my screen here so you guys can see what we're looking at. Now, guys, couple with infertility, right? It takes two to tango, of course. Now, so when you're struggling as a couple, what do you do? Well, obviously, you're going to have two different components. There's, you're a man and a woman. It takes a man and a woman to be able to conceive. Okay. Now, the easiest and most simplest thing you can possibly do to be able to either confirm or eliminate 50 to 60% of the issues that we see in couples is to be able to test this. You're going to test the man. You're going to do the semen analysis. All right. Now, so you're going to come down here. You're going to do the semen analysis. All right. Like I said, 50 to 60% of couples' infertility is male related. Now, once you get that semen analysis tested, obviously, if it's normal, right, then great. The man's done. All right. He just needs to make sure that sperm is getting to where it needs to go at the appropriate time, right? On or before ovulation. Now, if it's not normal, though, that's obviously confirming, hey, there's an issue here. In 50 to 60% of infertility cases, it is an issue. And the next thing your doctor is going to do is obviously check the hormones. All right. Are your hormones normal? If they're not, well, they're probably going to recommend lifestyle or medication changes, right? Lifestyle changes and or medication, all right, to be able to fix that. And once those hormones are under control, right, if you're still not able to conceive, well, then as a couple, you're looking at doing IUI, which is where they're going to take your sperm and inject it right into the uterus to make sure that you're overcoming any kind of physical obstacles, or you can do IVF, right? This is the simplest, easiest way to be able to eliminate a lot of issues that couples face. All right. And it's only a couple $100. That's why semen analysis is by far the most important test you can do as a couple when you're struggling with infertility. Now, guys, understand again, it is a couple's issue. Some issues are still, on the women's side, right? 20% are only male, another 40% roughly overlap. It's both male and female. And then roughly 30 to 40% is going to be women only. Now, if you're coming down here, if you're a woman and you want to get tested, right? The first thing you have to decide or determine is, are you menstruating or not? All right. It's as simple as that. If you're not menstruating, you're not having kids, unless, you're basically doing invasive procedures like like IVF. Now, so if you're not menstruating, obviously, the first thing you have to do is see a doctor. Okay, the doctor is going to help you make sure that you're reaching a point where you can menstruate. All right, and if you are menstruating, you're coming down to this section here. If the doctor can't help you menstruate, right, then the only option you have is you're either going to get a gestational carrier, right, somebody who can carry the baby for you, or somebody has to donate their egg to you and you're going to go through IVF. Okay. Now, assuming that you reach a stage where you're menstruating, right? The single most important test that you can do at this point is called CoV. This is going to test for a uterus infection. It's one of the most common causes of infertility that's overlooked. All right. We're talking about like 12.5% of women, over 1.25 million women in the US alone struggle to conceive because of this uterus infection. All right. CoV test for that uterus infection non-invasively. All you literally do is order the kit online. It comes to the door. You collect a small sample of menstrual fluid, mail it back, and get results. All right, it's that easy. Treatment's also super easy. So that's the simplest, easiest test you're going to do if you are menstruating. All right. Now, understand, guys, when you're testing, 1 out of 5 women who are testing are going to test positive for the infection. All right. That's of like all cause infertility, right? And if you do test positive, we are at Fertility Phoenix, they're basically going to connect you to a doctor for treatment. All right. Now, if you get treatment for that virus, 42% of women actually conceive after that treatment without needing any other intervention. All right. It's absolutely a game changer. You're literally like, you reach this stage, you're completely done. You don't have to do anything else, right? You just avoided all of the invasive procedures and unnecessary tests that you wouldn't want to worry about. Now, okay, assuming you get assuming you test positive, right? You get treated, now you're negative. Or if you tested negative initially, right, 4 or 5 wound will actually test negative. Great. Now you move on to the next step. All right. And that's checking your hormones, right? You're going to want to get your hormones checked because if they're out of whack, now obviously there's going to be some interventions that are required. Why are we doing CoV before doing checking the hormones? It's simple, guys. CoV is non-invasive and it eliminates or confirms like a major cause of infertility. But again, it's non-invasive. It's super easy, right? If you check hormones, however, regardless of whether it's positive, whether they're normal or not, you're going to have to do a ton of other stuff. And we're getting into invasive stuff, even checking hormones, right? You're getting poked in the, you're going to the lab, right? You're taken off of work, maybe you're getting your blood drawn, they're poking you with needles. It's inconvenient, you're missing work. And it's going to cost some money, right? Now, if those hormones aren't normal, right, what's going to happen? Well, the doctor is going to recommend a ton of stuff that now you have to do. You're going to probably have to take medication, and you're also probably going to have to make changes to your lifestyle. All right. We're talking at minimum 90 days change in diet, exercise, and other things, right? So we're going from the easiest things possible. The easiest thing is semen analysis. Next easiest is doing COVID, right? Now, getting to harder and harder things, which is checking hormones, because it's leading to a lot of difficult stuff. All right. If the hormones, once you get these hormones normal, either they were normal originally or through lifestyle and medication, right? The next thing the doctor's probably going to do, ultrasound, right? You got to check and make sure there's no physical obstacles to you actually getting pregnant. All right. Now, what this is, if it's not normal, well, you're looking at doing surgery or other interventions. But again, if the ultrasound shows the uterus and the ovaries are normal, well, guess what? You got more stuff to do because you're still not conceiving. So we're coming down now to HSG. This one is going to check if your tubes are clear or if they're blocked. All right. Now, if they are blocked, right? They're blocked. Okay. What are we going to do? Well, actually, luckily, during the same HSG procedure, if it's blocked, they're going to flush that out. All right. Make sure that the egg can go from the ovaries down the fallopian tubes into the uterus and get fertilized. Now, if it's blocked and they can't clear that, your only option, or if it's blocked or twisted or whatever means, if the egg can't get down that tube, IVF's your only option. Okay. But if they do get it clear, what are you going to do next? Well, the next step, obviously, if it's clear and the eggs are getting down the fallopian tubes and you know, it's meeting it's likely that it's meeting the sperm, but you're not doing that. Well, the next step is obviously you have some options here. You can do an IUI, that's the simplest, it's the least expensive. They just inject the sperm directly into your uterus at the appropriate time during your ovulation cycle, since they're fairly confident that your egg will be there to meet the sperm, get fertilized, right? Now, alternatively, you can do IVF or maybe some other interventions recommended by the doctor, okay? But again, you can see we've gone from the easiest here. Now, we've gone from the easiest. You guys are struggling as a couple. The man is going to do the semen analysis. That's the cheapest, easiest thing you can possibly do. The women, if you're menstruating, you check for this uterus virus. Why are we checking for this? Imagine this virus here is going to affect, like if you have that virus, it's literally going to mess up every single thing else that you do. All of these other tests and procedures, lifestyle changes, everything else may be completely unnecessary if if you tested for that virus and treated it right there at the top, right? I'm not even kidding. All right. You take care of this one here, it eliminates potentially all this down here. You wouldn't have to do ultrasound. You may not have to do medication, other interventions. You may not have to do IVF, all those things. Because why? Well, the virus that we're checking for up here with CoV is going to check for a virus that blocks implantation in the embryo. So even if you did IVF, if you have this virus, it's not likely to work, right? Because what are you doing with IVF? You're literally fertilizing the embryo, putting it in the uterus. But that virus that we want to check for, right? that virus is going to block it from implanting. So even though you're going through all of this, all these tests, procedures, you're getting poked and prodded, you're literally going on hormones. It's like an emotional journey, like a freaking roller coaster. All right. You're doing all that, but it still doesn't work because of that virus. Let's eliminate that virus first, right? That's the simplest, easiest thing to do if you're a woman. Eliminate the virus. It may eliminate the need for all these other expensive tests. But if you do end up needing it, now it's giving you the confidence that you can proceed with the rest of these procedures, knowing that you have a good chance of success of eventually getting pregnant and conceiving. All right, guys, I hope that helps. As always, my name's Daniel Knox. I love helping families, certainly awesome families like yours, and look forward to helping you guys in the future. Take care.